Hello class, this week we will cover oncology rehabilitation. So cancer is a major concern in every country including United States, and in this PowerPoint I did cover the recent stats of cancer, which will help us to understand uh, cancer diagnosis each year and different patient characteristics including age, racial, geographical location, and mortality rate. And as a practitioner, it is very important for us to understand cancer statistics so that we can identify the new trends and develop further interventions to improve prognosis. So, cancer stats of 2020 are mentioned here. So, some of the very alarming facts are that the rate of new cases of cancer is 442 per 100,000 men and women every year, and approximately 39.5% of men and women can be diagnosed with cancer at some point during their lifetime. And in 2020, an estimated 16,850 children and adolescents ages from 0 to 19 will be diagnosed with cancer, and 1730 will die of the disease. Now, the most common cancers, according to the 2020 list, are the breast cancer, lung cancer, prostate, rectum cancer, skin cancer, bladder cancer, kidney, renal, pelvis cancer, leukemia. So this is a list that we have as the most common cancers around the United States, in the United States, and around the world. So we have to know what are the most common cancers in the United States when we are practicing. It should be in our, because even for the education purpose, we should be familiar with the trend of the stats. And again, prostate, lung, and colorectal cancer account for an estimated 43% of all the cancers diagnosed in men in 2020. Very alarming. For women, the three most common cancers are breast, lung, and colorectal cancer, and they account for an estimated 50% of new cancer diagnoses in 2020. Now, a little bit cancer description. So, cancer originate in different body locations, and the according to the origination area, cancer can be described. So, the most common form being melanoma, which is described as a skin cancer. Also carcinoma, which is also a skin or tissue healing organ cancer. Sarcoma, which involves connective tissues. Leukemia, which is a bone marrow cancer. Lymphoma includes immune system. Multiple melanoma involves plasma cells and bone marrow. Central nervous system, which involves brain and spine. So So area where it originates that defines where the cancer or the name of the cancer. Now let's talk about cancer care continuum. There are different rehabilitation services included in the oncology rehabilitation, including occupational therapy, physical therapy, speech therapy, rehabilitation medicine. Now, cancer has different stages, as we know, and rehabilitation services are provided at different stages, which is also called cancer care continuum. So these stages include pre-treatment, newly diagnosed but no treatment initiated, active treatment, where treatment with there's a goal that there's active treatment going on, maintenance, this is a long-term therapy with goal of remission, post-treatment or survivalship, so medical treatment complete with no sign of disease, palliative care, that will be the last with the treatment when care is incurable with the focus on comfort and function. So what are different treatment options? The cancer treatment depends on the different factors such as type of cancer, stage of cancer, such as if the person is client is on early stage or late stage, and effect of intervention. That's the most important part too. The effect of treatment intervention on the individual's health, if they're able to bear the intervention, either it's chemo or surgical, if they're able to take that intervention and survive. The most common forms of treatment include surgical removal of cancer cells or tumor from the body, radiation therapy that focus on killing cancer cells or shrinking tumors, chemotherapy using drugs to kill cancer cells, immunotherapy which focus on strengthening and using a person's immune system to fight cancer, hormone therapy, stem cell transplant which restore blood forming cells destroyed by high dose chemotherapy or radiation. So now it is important to understand if the client is getting chemotherapy or radiation therapy, what will be the side effects or how the chemotherapy works. If radiation therapy that says focus on killing cancer cells and shrinking tumor, there will be side effects, right? We will cover that in this PowerPoint also. So when working with the cancer client, you always have to be mindful of some of the safety precautions. Now the cancer, every client you have to individualize treatment, but with the definitely with the cancer clients, you have to be very careful because of the adverse effect of the interventions, the medical interventions or medications they're taking, there are a lot of adverse effects on their body functions. So, occupational therapists providing intervention to the cancer client must take extra precautions. And in some cases, OT may require advanced training or specialization certification due to the complexity of the diagnosis. So occupational therapists must understand the effect of the medication, medical treatment on the client, and the effect, how it's affecting their body functions, which include changes in the heart rate, rhythm, dizziness, blood pressure problems, changes in vision, and changes in cognitive status, appetite, or metabolism. Now, occupational therapists must also consider two key measures when performing evaluation and interventions. Body functions and lab values are very important. So, when you're performing the evaluation and you're developing your intervention plan, you must consider their body functions and their lab values into that evaluation. So, observing the vital signs, including blood pressure, arterial blood pressure, intracranial pressure, respiration rate, heart rate, and oxygen saturation level. So these are very critical things that you must underline or highlight in your evaluation. OT practitioner should always or also consider the lab values, which can affect the client's functional performance. So some of the lab values which you have to look for when performing evaluation or intervention include the blood cell count, such as red blood cell count, white blood cell count, hemoglobin, and coagulation panels such as prothrombin time, international normalized ratio, and partial thromboplastin time. A basic metabolic panel including blood sugar, calcium, creatine. So these are all the lab values that you should consider into your evaluation. Now to start with the to understand the client, as we know, all different cancers have different stages, and every person will react differently. So you have to develop an individualized intervention plan, and to understand the client, completely understand the client, you have to start with the uh, occupational therapy domain and process, which covers almost all the factors and will help you to understand and actually break down the all meaningful activities the client wants and their background, their desires. So starting with their occupations, So this domain and process actually highlights all the factors here: patient factors, performance skills, performance patterns, context and environment where they live, or what are their rituals, where they you have to again we are considering all their factors such as home environment, do they live by themselves, or their religion, if they're spiritual, if they're what is their personality, and then when you do the evaluation, you have to identify the information about the client's need, problem, and concerns, and then it also covers the occupational profile, so summary of clients' occupational history, patterns of daily life, interests, and values, and analysis of occupational performance using assessment tools to identify the client's assets and problems. Then intervention, whether it's the skill services you are going to provide to facilitate client to improve the engagement in meaningful activities and help them to achieve their goal. Now, common cancer-related problems that are presented to an occupational therapist. So these are important to understand because once you're working in a clinical setting and you have a client and you see their medical record, you should be able to know or understand the client may present with these deficits due to the cancer or due to the medical interventions they are getting. So neurological deficit including hemiplegia, loss of coordination, loss of power resulting from primary brain tumor. So, a lot of actually working in the clinical setting, I have seen a lot of clients with neurological deficits, secondary to the intervention they're getting, or I'm sorry, secondary to the cancer, depending on the location of the cancer. If it's a brain tumor, it affects a lot of their neurological systems. And the common cancer-related problem also include if the client presents with spinal cord tumor or spinal cancer, you might see a client with paraplegia or quadriplegia, and maybe loss of limb or a part of part from amputation from soft tissue or bone tumor, usually sarcoma, and pathological fractures due to their primary bone tumor or secondaries. For example, fractured neck of the humor needs surgical intervention. You might also see shortness of breath resulting from the lung cancer or other cancers. Fatigue is the most common actually. Fatigue and lethargy. Lethargic client, you will see a lot of clients will not be able to perform function or daily activities due to fatigue. Lymphedema, that's another common problem you will see. Disturbance or impairment of auditory or visual function. Pain, that's also a major factor. Cognitive and perceptual deficits caused by primary brain tumor or so these are most common problems that you will see in a clinical setting when you're treating a cancer client. Now, the most used occupational therapy assessments in oncology rehabilitation include activities of daily living assessment, such as CAT scale, ADL scale. A1 is the cognitive assessment that directly links functional performance. So you're not just focusing on their physical aspect or physical function, you're also looking at their cognition because of if they're not cognitively improved or if there are cognitive deficits, there will be functional deficits also. And fatigue actually, fatigue's inventory, that's a short assessment which assesses their fatigue level or experience of fatigue over previous 24-hour. So fatigue assessment, I think, is very commonly used with the cancer clients due to the most because of mostly clients feel very fatigued after the intervention or chemotherapy or radiation therapy. And executive function performance test, that's another assessment. Functional assessment of cancer therapy is a assessment of quality of life. Cattle test is performance-based assessment. Again, is more cognitive functional performance. So a lot of cognitive and cognition test assessments there. Um, multiple errand test MET evaluates the effect of executive function deficits or everyday functioning through a number of real-world tasks. And then the pain scale, another important assessment or scale that is used with the cancer clients. Occupational therapy interventions. So now we will discuss what are the interventions that occupational therapists can do for cancer clients. So first, I'll start with the cancer-related fatigue. That's a major concern for cancer clients, and it's the biggest limiting factor, which limits their ability to perform their functional activities or participate in their meaningful activities. So as I mentioned, it's the most distressing symptom for cancer patients. CRF, cancer-related fatigue, is a significant factor which limits patient functional independence and performance in the occupation, role, routines, and their routines. So occupational therapists can use different intervention approaches to improve clients' functional performance in the ADLs and IADLs. So the interventions include create and promote. So therapists can provide patients with education on the management of their fatigue and promote health by guiding patients to improve lifestyle. And you can do take preventive approach to, so you can actually assess and screen client and their early signs of CRF and provide education and training to the client and the caregiver. So training of the caregiver is also very important, which will help them to actually manage and assist the client, and which will definitely minimize the effort and help the client to maximize their functional performance. And you can take a step, you can establish a restore approach that will be assessing the client living style, their daily routine, and develop an intervention plan which incorporates rest and exercises to minimize cancer related fatigue and its impact on functional performance. Or you can help them modify that. You can take a modifying approach, so you can modify their living environment, their assess their daily activities and see which factors are most affected and what are their meaningful activities, and help them to guide and provide them with the educational material, educational or skill training, so that they should be able to complete their meaningful activities before they get to fatigue. Activities of daily living, that's a, again, major part here. So cancer patient may lose their ability to function independently, depending on the stage of their of cancer. Their health can deteriorate, increasing day-to-day challenges to perform basic activities of daily living, such as even feeding and dressing might get very difficult for them due to fatigue, due to weakness, uh, poor muscle strength. So occupational therapists, we play a very important role here. So occupational therapists can use different strategies and techniques to improve patients' functional status, which includes you can train the client to use compensatory techniques for ADL activities, um, as you can provide them, recommend them, or train them to use adaptive equipments, or you modify their routine, modify their home environment to reduce the burden and improve their functional performance throughout the day. Now, orthotics, you can occupational therapies also. So occupational look at a whole domain. Again, the domain help you to understand what are the needs of the client, what are the if they have pain. So you come up with the intervention. Then if they need orthotics, occupational therapists can assess the possible dysfunctions or pain causing factors to cancer treatment. So occupational therapists can fabricate splints to minimize the pain and improve the functional position of the extremity, such as foot drop splint. If they have spinal cancer, you have to understand the limitations they have, the body deficits, and if they are unable to walk due to the foot drop, you might at night or for you might be making a splint or providing application of the splint for them, or wrist splints for radial nerve palsy. It's a different kind of splinting. Wheelchair assessment, and another very important role, and actually a lot of many clients after radiation, after radiation or different medical intervention, and depending on the stage of their cancer, they might lose the ability to ambulate. And if they cannot ambulate, their functional performance or participation in the aerial activities or meaningful activities will be very limited. So occupational therapists play a very vital role to educate the patient, suggest them, educate them, train them, uh, to get a wheelchair. Actually, occupational therapists also advocate for them and provide them assistance to get the script and get the wheelchair so they can maintain their independence. So occupational therapists can educate the patient on the alternate method if they are not able to ambulate, and very you have to come up use a therapeutic use of self to actually explain them and get them to understand why there is a need of wheelchair now, and to begin depending on the safety of the client, explaining them in a very, because it's a very sensitive topic. Not everyone will take it easily, and nobody wants to use a wheelchair at some point, and they have to, you have to educate. That's our role too, to educate them that why the wheelchair will be a good option for you right now. And in some cases, uh, depending on the cancer, again, if it's a bone cancer, if they're getting a lot of pathological fractures, walking might not be, or ambulating might not be an option for them. So wheelchair will be a necessary tool for them. So occupational therapists can provide wheelchair assessments and provide them with the most appropriate wheelchair with the most appropriate cushion to improve weight shifting and pressure distribution. Then energy conservation, a very, very important topic that we have to um, develop an intervention plan. We have to educate and train the client to use energy conservation techniques. If they're not implementing energy conservation techniques, they're, they will be limited with their functional performance. So fatigue and decreased energy is significant limiting factor for cancer patients to perform functional activities. Therapists can educate and provide training on periodic rest breaks and pacing activities to reduce the burden and maximize functional performance. Again, our goal is to maximize their functional performance. You want to keep them engaged in their meaningful activities. Pain and symptom control. Occupational therapists can facilitate patient with pain control using training on energy conservation techniques, correct body mechanics, positioning of the extremity if it's affected, environmental changes to improve comfort, and use of adaptive equipment to reduce the effort and improve participation in the meaningful occupations. Lymphedema, that's another very important topic. I've seen a lot of clients with the female clients with the breast cancer. They present with lymphedema of the extremity. So positioning of the extremity, skin inspection, a very, very important topic. So again, cancer treatment can have adverse effects on the body, including swelling of the limb, which can limit their functional use of the extremity, resulting in the increased need for assistance and limited participation in ADL activities. So therapists can always facilitate with the ADL activities by training them to use compensatory techniques, use of adaptive equipment, educating on proper positioning. That's, I've seen a lot of clients which will not follow proper positioning, let their arm hang. If there's a skin tear, they won't take care of it. There'll be weeping edema, or actually skin tear will turn into a wound then if there's a circulation problem. Now, psychosocial issues, very important topic. So again, you're not just addressing the physical symptoms, you're also looking at their cognition, their psychosocial issues. And so cancer patients face different psychosocial challenges throughout stages. So the stress related to the illness and bodily changes with the treatment effect are challenging to accept. There are a lot of bodily changes in cancer clients due to the intervention they're getting, such as the lose muscle loss, could be hair loss, different body changes that are occurring, and it's very depressing or stressful for the client. So we have to address that. So body image, you have to identify if the patient has problem with that. You have to um, there are different, again, a lot of different challenges for that and for them. So the changes in body and limited strength and functional ability results in loss of self-image and confidence. So occupational therapists can use different interventions for psychosocial issues, such as stress management, coping strategies, relaxation techniques, lifestyle management, cognitive behavior techniques, expressive sport therapy, and psychosocial training. Psychological issues can result in the depression and anxiety, which can significantly impact the quality of life and functional status. A therapist can use different assessments, which are utilized in oncology setting to measure the issue, include the hospital anxiety and depression scale, the Beck depression inventory, and the back anxiety inventory. These are the important assessments or tools that you can use with the clients to address their psychosocial needs, and with their physical needs also. These are the reference. Thank you.